Hi, I'm Dr. Jeff Banis, and I'm going to talk briefly about our shockwave treatment for erectile dysfunction or for anybody who just wants stronger and harder erections. First thing that you'll notice about our office is we're a sports injury clinic. We use the shockwave treatment for ankles, for knees, so for a variety of stuff. So if you're coming in for erectile dysfunction or shockwave treatment just to get harder erections, first thing is no one's gonna know what you're in here for, okay? No one's gonna think you're in here for that. And you'll be dealing with me directly. So there might be people in here working out, doing their therapy, doing their rehab. Like I said, we do shockwave on knees and ankles and everything like that. So no one's gonna realize that you're in here for the shockwave for erectile dysfunction. So there's no worries to be embarrassed or intimidated by something like that. And also you'll be dealing with me directly with no techs or anybody else. So you'll come into the office like this, and this is our shockwave machine. And what we'll do is we'll go inside our room here and go through kind of like the demo or kind of a rundown of what you're gonna actually do for the shockwave. Okay, here's what we're going to do is demonstrate the procedure of doing the shockwave for erectile dysfunction or for harder erections. Please excuse the drawings. Okay, so basically we got the applicator head here, and then we have the foot pad right down there. And what you do is you're going to be stepping on the foot pad, what's going to run the shockwave. So, one thing what we want to do with this is we don't want to necessarily, when we put the shockwave on there, we want at least a fairly nice little pressure on the penis or on the skin. Don't kind of put it away out. You want just a little, it's slapping, you saw it bounce around. So if that thing bounces around on your unit, it's going to maybe cause you some discomfort. But if you're actually applying pressure here, no problem. So what we're going to do is you're going to simply, and of course we're going to help you through this. We'll be outside if you need anything. You apply some ultrasound gel to the tip right here. And then basically what you're going to do is we're going to hit a couple different areas. You're going to apply it right at the base of the penis, and again you'll be stepping on the pad. You can see that. So what you're going to do is you're going to step on the pad here and apply 400 pulses here. Now after each set of pulses, what you're going to do is we'll be walking right over here and just pushing the reset button. Pulses, you'll see 0 pulses right there. So you see when I apply the pulses, you'll see the pulses going. So I'm gonna reset that. So there's where you're gonna look for the 400 pulses. So now we put it back down on here. So simply what you're gonna do, apply some ultrasound gel. You're gonna hit at the base of the penis here, step on the pad, and then you're just gonna kind of move it around like this. So you do 400 here, and then we're gonna break it up into zones. So we got 400 here, and then we're gonna do 400 pulses the lower half of the penis. So you're just going up the side and the top. So this is kind of like if we're looking down on it, okay? So how you do it yourself. So we do 400 here, then I'm doing 400 the bottom half, then I push reset, and then I'm doing 400 at the top half here, then over to the side, 400 pulses here, 400 pulses on the left side bottom half, 400 pulses the top side, and then we're going to do 300 here and 300 here. This area might be a little bit more uncomfortable for you. And then what we're going to do is put it underneath your testicles, in between your anus and your testicles, and we're hitting the prostate, all that area up in there. So now we're going to hit 2,000 pulses right there. So we'll have all the instructions also laid out here for you, and we're here to help you anytime you need it. So again, real simple is what we're going to do is you put the ultrasound gel on, you step on the foot pad, 400 pulses here, 400 in the bottom half, 400 in the top half, 300, 300, 400, 400, and then underneath your testicles, between your anus, 2,000. And again, you'll be just looking at the top right up here. And that's it. and we'll be here to help you. If anything you need, you just open the door and yell outside.